It's my understanding, and this may be, and we're going to get into this real quick with what you do for sleep apnea, because what you do is a little different than what is normally done. It's my understanding, if I go to a medical doctor or a sleep clinic for sleep apnea, and you have two wonderful examples here, I'm going to get what was commonly called a CPAP mask. Was anybody know anybody that got diagnosed for sleep? Is this what they get? Yeah, what'd you get? Everybody gets the same thing. It's not like there's even a choice. So if this is the choice, then why would I go get diagnosed if I'm not even going to wear it? If I know this is what I'm getting, why would I? So what is it that you do? How do you treat sleep? Because I know we've had a couple patients here that you've treated for sleep. What is it that you do for sleep apnea that's different than this?
Well, we try and find out if there is a sleep issue and what it is. If it's a central issue, or is it, where their sleep problems are. What's interesting is the tongue is attached to the jaw. And if the jaw didn't grow properly, or there's no room for the tongue has to go somewhere. And you don't really see, like a dog, you don't see humans kind of
hanging their tongue out, right?
Right. So usually what happens, and especially at night when you relax, the tongue goes back. Where's it going to go? It can only go backwards. It's pretty hard to go forward, and there's no room for it. And in some patients, you'll actually see little indentations in their tongue from the tongue trying to get out of that space back there, because
those little scallop marks you see on the edge of the tongue sometimes.
Right. And so that's a sign, and dentists should, when they see that, they should say, oh, you've got problems breathing, or the tongue's in the way. Then tongue might be too big for the mouth. Well, why is it too big for the mouth? Because the tongue is not too big for the mouth is too small for the tongue. So you do some expansion, appliances, you can move the teeth and the jaw out to create room for the tongue, and that usually stops the problem. Well, first, what we do is, you have to understand that that mask is called the standard of care, and that's been used for years. And the challenge with this is that we have found statistically that 92% of the people that have these are not wearing them after 6 months.
The CPAP.
Right.
Okay.
So what we do is we use what's called jaw advancement.
Okay.
We have appliances we put in the mouth, and we take x-rays of the mouth and jaw, and we find different ways of doing it by moving the lower jaw forward. Now remember, I was talking about the tongue being attached to the jaw. So if we move the jaw by putting a little appliance in your mouth, and there's different kinds of them, we have all kinds of them. What we do differently than most people, we've been working with a single one. So all they do is put this little plastic thing in their mouth upstairs while they sleep at night, and that keeps the jaw from going backwards, creates a space so they can breathe.
Okay, now I'm going to talk to you for a second, but before we do, this picture you're telling me shows the airway, right?
Right. This is a cone beam picture that is taken of the patient.
So this would be the neck.
Yeah, and you notice also the neck is straight, which is not normal. And it's straight, it's supposed to be curved, and it's straight because the person is being moved forward by the brain because it's trying to get air. And you can see here, this is the outline of the tongue pushing against the airway. The white here has been stained so you can see the airway. And this is volumetric.
And this is what he breathes through.
This little piece here.
Okay.
Can you imagine now that patient lying down and the tongue going even further back because of gravity? This is even going to get smaller. So now what we do, and rightfully so, you got to get some air. So we blow a reverse vacuum cleaner down their throat. Right, the CPAP, which pushes air through a machine through this to try and force it down this little tube.
Okay.
So now this other x-ray shows in volumetric that once we move the jaw forward, that the tube expands,
Because
and now naturally...
you don't have the tongue pushing back in on it.
Right, and so now naturally you get air without having to shove it down your throat.